Everything you've been told about trauma is wrong. For decades, we've called it a disorder, post-traumatic stress disorder, or PTSD. The implication? Something is fundamentally broken in your mind. You're weak. You should be able to think your way out of it. But what if trauma isn't a disorder at all? What if it's an injury? A physical injury to your nervous system, as real as a broken bone, as visible on a brain scan as a fracture on an X-ray. And what if the reason talk therapy and medication haven't worked is because we've been treating the software when the problem was the hardware? In America alone, 70% of adults have experienced trauma. That's 220 million people. Car accidents, combat, childhood abuse, assault, losing someone you weren't ready to lose. Stress that just never stopped. For many, the body processes it, heals, moves on. But for 44 million people, something gets stuck. The hypervigilance doesn't fade, the racing heart at random moments, nightmares that replay like a broken record, the inability to feel safe, even at home, even with people you love. And the statistics miss the real cost. The marriages that couldn't survive it, the careers that quietly derailed, the parents who were there physically but couldn't be present, the veterans who came home from war only to lose a different battle entirely. Treatments like SSRIs, talk therapy, cognitive processing, breathing exercises, they work for some people, about 30%. But for the rest, the pills blunt the edges without touching the core. Therapy sessions replay the trauma without resolving it. And the advice to just breathe or think positive feels like a cruel joke when your body is screaming that you're in danger while you're sitting in your own living room. Here's what nobody told you. This isn't because you're not trying hard enough. It's not because you're resistant to help. It's not a character flaw. It's because these treatments target the mind, the software. But trauma doesn't just live in the mind, it writes itself into your nervous system. It's not psychological, it's physical. You can't debug a program on a computer that's frozen in an endless crash loop. Dr. Eugene Lipov was born in Ukraine in 1958. His father, a decorated war hero who survived the Eastern Front of World War II, came home carrying wounds no one could see. The rages were unpredictable. The household walked on eggshells. Eugene learned young what it meant to live with someone whose nervous system was stuck in a war that had ended years ago. The consequence? By 6, he had already planned his own suicide. He understood trauma not as a textbook concept, but as something that had lived inside him. His mother was a physician, brilliant, loving, but years of absorbing that stress had worn her down.
"This is going to kill me,"
she told her son before he left for his medical residency. 3 months later, he found her body. Something broke in him that day, but something else was forged. The psychiatric system had failed her. The medications, the protocols, the standard of care, all of it. He made a vow, learn why, and spend his life making sure it never happened to anyone else. The breakthrough came by accident. They often do. Dr. Lipov was treating a breast cancer survivor for severe hot flashes. Hormone therapy was too risky given her history. So he tried something unconventional, a procedure called a stellate ganglion block. It targets a cluster of nerves in the neck that help regulate the body's stress response. The hot flashes stopped, but then she said something unexpected.
"Doctor, my anxiety, it's gone. For the first time in years, I actually feel calm."
That single sentence changed everything. Because Dr. Lipov realized the nerve cluster that controlled hot flashes was the same nerve cluster that controlled fight or flight, the body's alarm system. If he could quiet those nerves for hot flashes, could he quiet them for trauma? Could he reset the alarm that had been ringing for years? Dr. Lipov calls the sympathetic nervous system the invisible machine. It runs beneath your awareness, regulating everything: heart rate, breathing, digestion, your response to threat. In a healthy system, this machine idles quietly. When danger appears, it revs up. Adrenaline floods your body, your senses sharpen, you're ready to fight or run. Then, when the danger passes, it powers down. You return to baseline, safety. But in someone with trauma, the machine gets stuck. The war ended. The accident is over. The abuse stopped years ago. But the machine never got the signal. It keeps running at maximum, 24 hours a day for years, sometimes decades. This is the biology of trauma, not weakness, not a character flaw, but a machine that can't turn off. Here's why you can't think your way out. Your prefrontal cortex, the rational part, the part that knows you're safe, is being constantly overridden by your amygdala, the fear center, the part that doesn't care about logic, it only cares about survival. And the amygdala is being flooded with signals from that broken machine in your neck, an endless stream of danger, danger, danger. Think of it like this. Your brain is a computer. Talk therapy works on the software, the programs, the patterns, the ways you process information. But when the hardware is overheating, fans blazing, circuits overloaded, no software can run properly. Trauma survivors don't need better software. They need a hardware reset. Only then can the software run smoothly. There's a reason Dr. Lipov doesn't call it PTSD, post-traumatic stress disorder. He calls it PTSI, post-traumatic stress injury. This isn't semantics, it's a fundamental shift in how we understand what's happening. Disorder implies something is wrong with you, that you're broken in some unfixable way, that you'll be managing this forever. Injury means something happened to you, something physical, something that can heal. Imagine you broke your leg but felt ashamed of it, so you spent your life limping, hiding the pain, never getting it set. You took pills to dull the ache. You talked about the accident that caused it, but the bone was never reset. That's what we've been doing with trauma. Dr. Lipov's technique is resetting the bone. But he didn't stop at the standard approach. Through years of research, he developed something more precise, the Dual Sympathetic Reset. Instead of one injection at one level, the traditional method, DSR, targets two specific points on the cervical spine, C4 and C6. This ensures the entire nerve chain feeding the brain's fear centers is reached. The painless procedure takes less than 10 minutes, and anesthetic, the same used at the dentist, is applied precisely with ultrasound imaging. And then something happens that patients struggle to describe. The noise stops. Patients call it the God shot, not because it's a miracle, but because the shift is so sudden and so total, it feels like grace. And you realize you're safe, actually safe, for the first time in years. Here's what's most exciting. The anesthetic wears off in hours, but the relief can last months, years, for many patients, the rest of their lives. How? Dr. Lipov's research points to something called nerve sprouting. Chronic trauma causes excess nerve growth in the sympathetic chain, new fibers that keep pumping out stress hormones even when there's no threat. When the anesthetic blocks these signals, it doesn't just pause the alarm, it allows those excess nerve fibers to die back, to prune themselves. Think of rebooting a frozen computer. It doesn't just restart, it clears the glitches that caused the crash. When the nervous system comes back online, it comes back at the original baseline, not the trauma baseline, the baseline of who you were before the machine got stuck. These results are backed by science, published and peer-reviewed. A landmark study analyzed over 300 patients. 81% showed significant improvement. The average reduction in symptoms? Nearly 30 points on the standard PTSD scale. That's the difference between debilitated and functional. Military women who had experienced sexual trauma showed the strongest response, 39 points of improvement on average. Around 10,000 people have now received this treatment. Some are approaching 15 years of sustained relief. And here's what silenced the skeptics. When researchers combined DSR with intensive trauma therapy, they saw the greatest reduction in PTSD symptoms of any clinical trial they had ever conducted. A study in the VA using advanced scanners showed actual brain change during the procedure. The reset doesn't replace the work of healing. It makes the work possible. Trevor Beeman served in some of the most dangerous places on Earth. He came home carrying the weight of what he'd seen, what he'd done, what he couldn't forget. The suicide attempt started before the military, age 12. Combat made it worse. For years, he saw ending his life as the only honorable exit from a mind that wouldn't stop attacking him. Therapy hadn't worked, medication hadn't worked. He was what doctors call treatment resistant. After DSR, the suicidal thoughts stopped, not managed, not suppressed, gone. Today, Trevor speaks publicly about what happened to him, not as a patient, but as an advocate. Proof that the story can change. Dr. Eugene Lipov has dedicated his life to this work, and now he is part of the AURA team. Our physicians have been trained directly in the Dual Sympathetic Reset protocol, the exact technique that Dr. Lipov pioneered. Same standards, same precision, same commitment to outcomes. But DSR is one tool in a larger approach. At AURA, we understand that resetting the hardware creates an opening, a window where real change becomes possible. When needed, we pair it with the groundwork that makes it stick. Nervous system support, sleep optimization, nutritional guidance, and psychological support. And the applications keep expanding, from generalized anxiety and treatment-resistant depression to the autonomic chaos of long COVID. Wherever the nervous system is stuck in overdrive, this reset shows promise. We don't just flip a switch and send you home. We help you build a life where the switch stays off. You've carried this long enough, you can finally let go and take a deep breath. The vigilance, the racing thoughts at 3 a.m., the sense that danger is always just around the corner even when you know that you're safe. That's not weakness. That's not a disorder. That's an injury, and injuries heal. If you're ready for your reset, we're here. One conversation, that's where it starts.